lecture in the final of our Caribbean Climate and Health Responders course. Live interpretation is available in English and Spanish. Use the button at the base, please. Next. And we are at the end of an amazing series in this Climate and Health Responders course, version 2. We've been through the general stuff, the disease-specific stuff. In the last couple of sessions, we looked at health system resilience in a changing climate. Health sector mitigation and adaptation was last week, earlier this week. And now we're going to be hearing from Dr. Carlos Ferron. I'll introduce him in a moment on climate change and health equity. So today's objectives are to define climate health vulnerability, adaptation, and resilience, identifying the social and environmental determinants that make people and communities more vulnerable, because the impacts of climate change are not evenly distributed. Some of us are more vulnerable than others. Describe the concepts of climate justice and environmental justice, and demonstrate how to supplement theories of collective and transgenerational ethics and ethical obligations. So this should be a great session. I remember Dr. Ferron's last time he spoke to us, and it was great. Logistics, remind you that this is a 90-minute session. Please enter your questions for presenters in the Q&A. The video recording, reference materials, and slide decks will be included on the website. One free CME credit is applied per session attended in person. You must be in person. Application is made by completing the Google link posted in the chat at the end of every session. And the link is open until 12 p.m. the following day. Next. Now, because we're in the final session, I'm going to speak on the final exam and certificate. The participants who attend more than 7 of the live Zoom sessions and pass the final exam with a score of more than 70% will be awarded a certificate of participation from Earth Medicus Nurse and the Global Consortium on Climate and Health Education. To be eligible, you must join the class session using your unique Zoom link and complete the final exam using the email address used to identify you initially when you registered for the course. This exam will be sent out on the final day via email and in the WhatsApp link. I'm happy we have well over 600 people on the WhatsApp. The exam link starts at 8 p.m. tonight and will close 48 hours later on May 4th on Saturday. The format is multiple choice, true, false, and participants should be prepared to take the exam in one sitting. That is, you cannot start, sign off for a couple of hours and come back. It will not be safe. You must take it in one sitting. That sitting can be 1 hour long, 2 hours long. It's up to you, but it must be in one sitting. Certificates will be awarded in the period May 9th, 10th from the email that you see there. Next. So tonight, I'm really happy to introduce our 2 presenters, Dr. Carlos Ferron Guzman, who is Associate Professor of Global Health at the University of Maryland in Baltimore, and he's the Assistant Director for Planetary Health Alliance at Harvard, and Carlos is de Costa Rica. And Stephanie Chukalam from Suriname is the head of the Environmental Inspection Department at the Bureau of Public Health, the BOH. And between them, we'll be hearing a lecture and then a case study on the experiences that she has in Suriname. Is that it for the introductions? Right, so thank you very much, Carlos. I'm going to pass over to you. Welcome again to everyone. Bienvenido, bonsoir. We're going to finish up the series with a great talk tonight.
Thanks, Dr. Hospedales, for that introduction. Pleasure to be here again. Really a pleasure to be part of this course and seeing now over 400 participants have joined, which is an amazing amount of people. This is what we call building the workforce for the climate emergency that we're seeing right now. So I'm glad that most of you are coming from the Caribbean. I myself am from Costa Rica. I'm a Central American. I'm born and raised here. but most of my work is in the United States. However, I spend most of my time here in Costa Rica, where I am right now. And really, really just glad to be able to share with you. I saw some ticos in the chat, so hi to my fellow ticos. And from everyone in Latin America, un gusto verdaderamente estar aquí con ustedes. So I'll try to capture some of the things that you have been talking about, and I know you've been in this course for now 9 sessions, and you've explored in depth how climate change is affecting health. And I know that throughout some of that course, you've explored the concepts like vulnerability, vulnerable populations. You've explored the concept of equity. You've explored how populations around the world can be impacted differently from the changes that we're seeing due to climate change. So this session is trying to hone down in that and provide a framework, both conceptual and also kind of in action, in order for you to take, I know a lot of you are clinicians, in order for you to be able to contextualize this in the context or the place of work, wherever that might be. Also, I want you to look at this lecture not just for clinicians, but I know a lot of you are working as well at administration levels, or might be decision makers, or might be at the director or similar levels making decisions for other clinicians. So hopefully this session will guide some of the decisions and the prioritization that you make as you move forward in your work as we face these global environmental changes, including climate change. So I'll start sharing my screen. I'll be able to see the chat for the most. It does move quite quickly, given that this is a large group. Let me just bring up the chat. Another caveat is that I actually forgot my whiteboard. So I'll have to do this with my hand. So you'll see my hand coming into the screen a lot, and I'm just drawing over the screen. So excuse that. I'm going to doing this. This is just my hand over the screen. So don't be scared. I'm not pointing at you. I'm just drawing on the screen. I usually do that on a tablet, but I didn't bring my pen, my tablet pen. So hopefully that's okay. And don't be scared. Okay. All right. So as I said, this will be a focus on climate change or large global environmental changes and how they're impacting equity. We'll go through over some very basic concepts, and then we'll evolve from there. So as I said, so far, you've been exploring how these two concepts, climate change and health, are interconnected, right? And basically, as you're studying infectious diseases, as you're studying mental health, as you're studying the different ways climate change is changing the environment and how it's impacting health. Today, we're going to take a lens on kind of how we can use equity in a transversal manner to understand not just the underlying drivers of some of the ways people are being impacted differently, but also the ways people are being impacted differently and how we should use equity in a solutions focused way. So when we think of this concept of equity, and here I'm obviously using a play on words there, equity and equality, we use equity when we want to demonstrate or when we want to point to a difference or an absence of a difference from a moral standpoint. That is, when we look at a situation and it's either deemed fair or unfair. So we use equity. When we talk about equity, the difference that it has with equality is that equality doesn't carry, let's say, that moral, fair, or unfair judgment. And equality is just a situation where everything is the same, disregarding whether there's a moral difference or not. When we use terms like equity and inequity, right? In Spanish, equidad o inequidad. In Spanish, equality is igualdad o desigualdad, right? When we're using those terms, inequity, we are loading the word with a judgment of fairness and unfairness, right? So when we use inequity, right, it means that we are determining that there's a difference, be it mortality, be it access to vaccines, be it access to healthcare, be it access to quality education. We're deeming that two populations or two individuals have a difference, and we're saying that that difference is unfair, and that's why we use these terms distinctly. So just a 101 on how we use these terms differently. And I hope that we can have more conversations around this. I don't want to spend too much time here because I know you've spent a little bit of your time in class already discussing these terms. So as I said, when we actually use an equity analysis and we use the equity framework to connect these dots between climate change and health, we need to do that at 3 moments, right? And it's not just how, it's not just how climate change is impacting different populations around the world, right? But it's also analyzing the underlying drivers, that is the whys of the whys of the whys. These impacts are differently. And as well, equity is a framework that we use in order to design solutions. So these are the 3 moments that we use the equity framework. These are not just how differently people are impacted, but why are people impacted differently, and how do we go about finding equitable solutions? So I'm going to start talking about these 3 moments in my slides, and then probably we'll leave some of the solutions part to the case study, but as well to the discussion that we're going to have later, because solutions will look very differently depending on the challenge that you're working on, but also the place that you're working on. So I don't want to get ahead of myself too much in this regard. Now, before we dive into some of these underlying drivers and the impacts on different populations, I want to also explain 2 concepts that are important. One is vulnerability, and the other is resilience. And these are, let's say, sister concepts. They're like a little bit of yins and yangs, so to speak. They complement each other in ways that kind of we can incorporate in our language, right? So vulnerability, just as it sounds, right? It's basically that it's a function of, let's say, character, so to speak, and a characteristic, right, in which we take into account these 3 things that you see in the slide. We take into account what is the capacity of I'm going to use system, right? But we can use, instead of the word system, we can use the word individual, community, nation, right? But I'm going to use the word system just for clarity. But when I talk about vulnerability and resilience, I can also talk about communities, individuals, and nations or regions or whatever it might be. You might substitute that to what is relevant to you. So adaptive capacity, right? When we say adaptive capacity, it refers to this ability, right, of individuals, community, nations, systems to develop what we call resilience, which is a concept I'll explain in a second. And specifically when we're talking about climate change, is the ability to develop resilience in the face of climatic risks, right? This can be expressed in ways such as accessing, let's say, my adaptive capacity is my access to financial resources that allow me to survive during a loss of harvest. Or it might be my ability to access nutrition while there's a drought. It might be my ability to access new technology, like new seeds, while there is change in how I grow my food. It might be my access to a network of support that allows me to thrive despite hardships that might be momentaneously or permanent. So that is more or less when I talk about adaptive capacity, and that's a part of vulnerability. Obviously, the more adaptive capacity you have, the least vulnerable you are. And these are kind of counterweight concepts. And then on the other side of the equation, the more sensitivity and the more exposure you have, the more vulnerability the more vulnerable you are, or the more vulnerability an individual, a community, a nation, a region, a system is. Now, sensitivity, right? We might think about it as an internal factor of the individual, community, nation, region, or system, right? You might, when we bring it down to an individual level, you might think about this as, let's say, sensitivity is immunity, so to speak, right? So, for example, if your livelihood depends on things like tourism at shore, and maybe your whole livelihood, the community livelihood, depends on fisheries, and because of how climate change is happening, fish are moving out of your waters, then that person has more sensitivity because their livelihood depends almost solely on those fish or those coastal activities, right? Or think of a community that might not have trees planted to maybe secure them from a heat waves, right? And trees play a major role in controlling, especially in urban environments, when there are heat waves. So the sensitivity is this internal factor that individuals, community, nations, regions, systems have, right, in order to kind of wind off some of the elements that are expressed in the exposure, which is, we may think about it, if the sensitivity is internal, we might think of the exposure as the external factor that plays into vulnerability. So, for example, right, things like extreme weather events that you've talked about, things like emergent infectious diseases that you've also talked about, things like access to health systems that you've also talked about, or lack of access to health systems, all increase, or how those health systems are conformed, all increase your degree of exposure, so to speak, right? So the more sensitivity, the more exposure you have, the more vulnerable you would be to climate change. So in this combination, this is kind of the graph here, the more adaptive capacity, right? The lower your vulnerability, right? So this is more or less how we understand. And in conjunction with these terms, right, we think of resilience as this ability to cope, right? Resilience, we might think about it about something like a rubber band, right? When you stretch a rubber band, it can only stretch so much that then it breaks. But some rubber bands can stretch much more and have more resilience to then return to a new state of stability in which it can still function as a rubber band. Similarly, individuals, systems, nations, regions, neighborhoods, communities have that ability to cope through, let's say, a hazardous event, or responding or reorganizing in ways that allows them to fulfill the essential function that they are there to do, right? And you talked about health systems a little bit, and building climate resilient health systems. It means being able to build health systems and cope and thrive and do the essential function despite the fact that climate change is there, right? So this is how we understand a resilience. There are some related concepts that are sometimes spoken when we talk about resilience in the literature. One is bouncing back. That is, if this is my core level, right? This is my level, basic level of where I am. Let's call it the homeostasis of an individual, community, level, nation, whatever. And there's a hazard, and it brings me back to this level of, let's say, illness or disease at a societal, at an individual level, whatever it might be. Bouncing back means being able to come back to this homeostasis or this initial point where system properties are restored. Bouncing forward means not just being resilient, but also being to thrive after the hazardous event. So obviously, when we design strategies to make populations resilient, we don't want them just to bounce back. We want them to bounce forward and be able to thrive. These are concepts that I want you to be familiar with. Obviously, from the way the literature is set, there's a lot of interpretations of some of these. Some of the literature that you will read will define these a bit differently. They incorporate different ways of explaining this, but basically, right, this is what I wanted to show you in these 10 minutes of introduction of these concepts. Now, jump into how health is impacted by climate change. This is where you've spent most of the time in your course. So I won't spend most of my time in this. But just to say, again, when you're exposed to the literature and when you're Googling climate change in health, there's going to be a flurry of models out there. There's going to be, each organization will build its model, each author will build its model. And you know what? I've built my own model, and I want to show it to you because I think it summarizes some of the ways that we can understand this. In essence, when we talk about how climate change is connected to health, we are talking about how climate change impacts the determinants of health. That is it. When you look at all these models, each of these what in essence they're telling you is that climate change is impacting the determinants of health. Most of you are well aware of the determinants of health, so I'll just spend 3 minutes here explaining these from its two more popular models that we see when we try to explain. To the right, you have kind of the older model of the determinants of health, the Dalgreen-Whitehead model, kind of from the 90s. And this is what we call an ecological model, sometimes also called onion layer model. It's quite obvious why it's called an onion layer model. Ecological models use similar diagrammatic approaches. So in this diagram, this is basically tell you, right? It's basically answering, what does health depend on? So in this model, the closer you are to the center, that is, the closer you are to the individual, right? The longer you are or the farther you are from the center, the farther you are from the individual. So there's layers from individual to, let's say, policy and governance. And in between, you find things like my choices, my community, my work, my education, the exposure to air, water, etc. And then you have this wider social, economic, environmental, cultural, political, governance-related sphere. So because this is close to the individual, the center, we call these proximal determinants. And those include things like your age, your sex, your genetics, evenly, so close to you that they're even inside your cells, right? This is what we call proximal. And further of the individual, this is what we call distal, right? And these where these terms come from. Literally, proximal and distal are just how close they are to the determinants. That is, how close are the things that determine your health to you? Okay. Then we go to the kind of the newer conceptual model, which is based on health equity, developed by Michael Marmon and the working group on the determinants of health from the WHO. Also kind of old now, right? 16 years ago, but still very relevant today, where you take the ecological model, you turn it into what we call a flow diagram, but the concepts remain. The basic question is, what does your health depend on? But it really focuses and changes the conceptual of these distal and changes the wording a little bit and calls them structural, right? So these are the structural, but the individual is here and still the proximal is here, but instead of distal, they're calling it structural. That is, these are embedded in society. This is basically the bedrock, the foundational cornerstones of society is what makes up our health. And a lot of times we don't even notice them because they're not even tangible things. Think about policy. Think about the role of policy and how it impacts your health, right? Policy is not something you can touch. It's not water. It's not a clinician. It's not a vaccine. You can't touch policy. You can only see the consequences of policy. And sometimes those consequences are not completely clear. So if tomorrow a country like Costa Rica passes a bill that says all doctors now work in the public sector and no one can work in the private sector, right? That will have a direct consequences where probably more access will be achieved. But what happens if the opposite happens, where the public sector closes and now there is no access to public sector? The consequences of health, right, of a policy will probably have trickle-down effects on the population that depended on that public access. And that is hard to connect sometimes because the consequences might depend on not just whether you had insurance or not, but whether you were close to a clinic or not, whether you had access or education, whether you are a woman that is taking care of your children and can never go to the clinic, and many other things, right? So policy always plays in an kind of woven way with other elements of things. So this is just a broad overview of how we understand the basic question of what does health depend on. Now, I'm going to reinterpret this in a way that we start understanding health as a product of an eco-social system, because this is what we're trying to study. So in this paper, I argue that a way of understanding the determinants of health beyond ecological diagrams, beyond flow diagrams, is using a lens of what we call complexity theory. Now, complexity theory sounds like it's scary, sounds like something that some of you might have heard of, and that you decided to kind of turn the page and move to the next book or the next chapter. but it's basically simple. It's the way we understand things by the very principle of all things are connected, right? And in this diagram, what I wanted to portray is that when we think about what does our health depend on, it really the interplay between these factors that determine our health is multiple, sometimes even unknown. So here you have a list. This is just a list. It's a very close list, but these lists can be infinite of the things that your health depends on. Things obvious as constitutional factors like your biology, your DNA, things as whether you're exposed or not to infectious diseases, whether you have good air quality or not. But there's other things out there that your health also depends on, like your macroeconomic context, right? Where is the macroeconomic context of the place you are? Like that policy environment, like the governance schemes that exist for decision-making processes, your socioeconomic status, the labor conditions, whether there's good systems that are producing food or not, how is the land use, how is the education system, et cetera, et cetera. But instead of seeing these as separate, this diagram tries to show them as a conjunction of elements in a system that are all intertwined, interconnected. So you might think of these as floating in a milieu, and the weight that each of these play in your health, an individual's health, a community's health, a regional health, nation's health, really depends on three elements. And they are the why, the who, the when, and the where. That is, when you apply these three things, who, when, and where, then the weight of some of these might change, right? We already established that these are interconnected. Of course, your socioeconomic status is related to your ability to gain a good education. Your ability to gain a good education is connected to the labor conditions that you will have. Your labor conditions that you have at the same time determine your socioeconomic status, that at the same time might be related to the race or ethnicity that you are from. At the same time, that will determine whether you have access to good or bad or medium social capital. At the same time, your gender might be playing a role. But all those things, the weight that each of those things are playing depends on who you are, when you are, and where you are. And this is to just portray how dynamic this is. It is not the same to be a woman in, let's say, modern day Afghanistan than to be a woman living in Brussels, the capital of Europe, so to speak, right? So the access to rights, the way gender plays a role, the way education plays a role, the way you have access to different components of a health system, the macroeconomic policy context, all of those are playing a role, and the outsized weight that actually is impacting that person's health in this example of a woman in Afghanistan and a woman in Brussels is their gender. So gender plays an outsized role in that example. And just like that, we can change from the who and the when and also the where, because none of this is static. All this is moving around from day second to second. It is not the same to be a woman accessing abortion care in the United States 2 years ago before Roe v. Wade was overturned to today, where bans and limitations to sexual and reproductive rights in the United States are being limited. So it's very dynamic. And what happens as the interaction of all of these, right, as they interact amongst each other, is that the product is health. Health is a product of this eco-social dynamic system. So when we understand health like this, right, we start seeing that health is not static. Health, defined by the WHO, is a complete state of mental, physical, emotional, social well-being. But in reality, it's also a dynamic state. It's not just a complete, it's a dynamic state. And we must add that word dynamic because it changes from time to time. So going back to what attains us today, which is climate change, and you might have seen a figure like this before, you might have heard this concept before, right? Which is climate change is a threat multiplier. When you think of this system of the determinants of health and each of those components interacting amongst each other, think of those as a, as almost like a cell, and that there, each of these organelles or parts of the cell, which are the determinants of health, are interconnected. There are connective tissue actually there. And when you add an external injury to this system, in this case, climate change, you're basically changing the conformation of the whole system. And this figure here, these waves, these ripples, right? I call these reverberations. So think about what happens to a connective tissue and the components of that connective tissue when you reverberate, when you vibrate a change into that system. The conformation of it completely changes. And that is why we say climate change is a threatened multiplier. It changes the conformation of the determinants of health and makes people more vulnerable and makes people less resilient. And hence, this new status of health becomes less good, so to speak. So health diminishes in the face of climate change thanks to this new conformation. But it's also worth noting that climate change does not happen in a vacuum. What you're seeing here is a schematic representation of the concept of planetary health. And this is kind of not easy to follow. I'll try to explain this in a nutshell so you can understand what I'm saying. But when I say climate change does not happen in a vacuum, it is what is meant is that there are what we call other global environmental changes happening simultaneously to climate change. So which ones? So we talk about pollution, for example. Pollution is not something that's just happening now at the edge of our neighborhoods. The trash that we see in our neighborhoods, the lack of recycling that we see in our neighborhoods and cities. Pollution is now happening at a scale that is unimaginable. Pollution has seeped through all the ecosystems in the world. We can find traces of human activity in pollution in absolutely every ecosystem in the world, in the form of things like plastics, nuclear waste, heavy metals, non-organic, organic compounds, all of those we can find, not just at a local level now, but even in places where humans don't even live. And we even find them inside organisms, where we find traces of our activities inside organisms. We see accumulations of things like mercury. We see accumulations of things like plastics in the food web. And that is how bad it is getting. It is not just our air that is being polluted severely by our economic activities, but it's also our waters, it's also our soils, and all parts of the biosphere are now tainted at a global scale. Of course, there's places where that pollution level is less, but the scale of it now is happening at a planetary level. Then there is the concept of biodiversity loss, which is another large-scale environmental change that is happening. That is, we are losing vital biodiversity, not just rhinoceros, which are kind of these very visual species, not just orangutans or chimpanzees. We're losing things like fungi and bacteria and archaea and different forms of life that we might not even know exist. And we can trace this, we can measure this in a way that is impacting our health as well. Not because our life depends on that biodiversity. We can also talk about another large-scale environmental change, which is the biogeochemical cycles. As you know, the Earth cycles different elements through air, water, soil, life forms, and on and on. Things like carbon, things like oxygen, things like CO2, they're all cycled in these ongoing, perpetuous ways of how it moves through the biosphere, right? Now, there are cycles that are altered significantly thanks to human activity. Of course, we know CO2 is one of those, right? And the greenhouse gases that's causing, and the global warming and the acidification of the oceans, all as a consequence of a mismatch, or let's say an alteration of the CO2 cycle. But there's also others like nitrogen and phosphorus. And because we have used an enormous amount of nitrogen and phosphorus in our agricultural activities, mainly in the form of fertilizers, that is accumulating in the system to a point that is having detrimental consequences over ecosystems, mostly water ecosystems. So if you've ever heard of the term eutrophication, eutrophication describes what we call a nitrogen runoff, that is nitrogen that is put in an agricultural system, then it's put in excess because it's very inefficient on how we put it in. We put a lot of nitrogen in there. When it rains, that then runs off into waterways and bodies of water, eventually joining larger bodies of water, eventually reaching the ocean. When that nitrogen accumulates, it creates an alteration of the ecosystem that is called eutrophication, where there is a blooming of an algae that then consumes the oxygen of the water and then kills off many of the other species that live there. And it creates these gigantic dead zones, as they're known, like the gigantic dead zone of the Gulf of Mexico, which is a consequence of the agricultural activities of the Mississippi River Basin. So that is happening as well. We are also, and I keep going here, altering how we use our land at a massive scale. Of course, this is not just how we build our cities and how our cities grow. That is part of it, but most of the way we are changing the use of our land is through the large-scale agricultural activities, mostly in industrial monocrops. Some of them might be prevalent in the countries where you live, things like soy, things like palm oil, things like corn, things like wheat. They're all altering the soils, the land, and it's changing the natural cycle of these ecosystems, having consequences over things like biodiversity, having consequences like things over the quality of the soil and the species that live in that soil, the bacteria that live in the soil, et cetera, et cetera. Right? We talked about the oceans, which I'm talking about here. I'm just going over each of these. And as you can see, the principle here, and this is climate change, which I always mention last, but this is kind of the central part of this class, right? You can see from this that these, what I call anthropogenic changes to Earth's natural systems, I'm just going to put it here, anthropogenic changes to Earth's natural system, they're all interconnected as well, right? We can't talk about land use change without talking about biodiversity. We can't talk about altered biogeochemical cycles without talking about land use change and global pollution. We can't talk about land use change without talking about climate change. All these things are interconnected in ways that sometimes we know or we're starting to understand, to ways that we do not know or we still don't understand. That's why these Webby figure here is interconnected. So the basic premise of planetary health is that these changes that are happening in a geological epoch that we call Anthropocene, that is literally the age of humans, right, are altering people's health, right, are altering the patterns of infectious disease, non-communicable disease, nutritional disease, mental health related disease, and sexual and reproductive health related disease, which is what you've been focusing on for the last 9 sessions. And then we use these, right, these figures in the middle, right, in order to understand the pathways by which these anthropogenic changes to Earth's natural systems are impacting human health. So what does gender have to do with it? What does displacement have to do with it? What does health systems have to do with it? What does governance, socioeconomic status, constitutional factors, genetics? We use those to understand the pathways by which. And because we use this complexity or system thinking lens, we know that these as well are all interconnected amongst each other. So this is the basic premise of planetary health, understanding how health is being affected in the Anthropocene. But we're not just about studying these concepts, we're also about studying the solutions, right? So when we're talking about that, right, I'm going to go back to my diagram here of the 3 moments that we're using equity. We just understood how we use equity to understand the analysis of the underlying drivers. We're going to move now how it's going to impact. I'm going to focus now on some of the combination of this. So for example, when you look at, let's say, vulnerability, there's a score, there's an index that you can score more vulnerable populations around the world, right, regarding how vulnerable they are to climate change. And there's likely an update on this figure that I didn't look up, but if it changed, it likely changed a little bit. So what you can tell from this figure here, right, is that most of the countries that are more vulnerable, that is the darkest colors, are what we call, quote unquote, the global south or quote unquote lower middle income countries. Now, that is not a coincidence, of course. This is basically a consequence of our economic system, right? The more resources you have as a country, as a nation, resources, not just financial, but all types of resources. Your energy system might be a resource. Your health system might be a resource. Your education system might be a resource. Your lack of corruption might be a resource, right? The more resources you have, the least vulnerable you are. But the question here is, if these are the more vulnerable populations, shouldn't we be doing more to help them increase the level of resilience and decrease the level of vulnerability? Because we know as well, the more vulnerable you are, the more you're going to suffer the consequences of climate change, such as displacement. Displacement is one of the big drivers of health changes or illness and disease when we're talking about climate change. And I can't remember if you overviewed displacement and migration as a consequence of climate change. But of course, this is one of those factors that will impact everything from your ability to access food, to your ability to have shelter, to your ability to have even a legal, quote unquote, status in the country where you are migrating on. And so the consequences of that will have ripple effects as well over all your determinants of health. And these are just some numbers from the World Bank on how many people will be internal climate migrants by the year 2050 in a status quo scenario. When we talk about resilience and vulnerability, right, and how we seek, let's say, how we understand these and the consequences that it's having all around the world, this picture for me really represents some of that. So these are pictures of two different environments and how they are coping with a sea level rise, which is one of the consequences of climate change, as we know. These are two coastal places in the world. One is in the Netherlands, and the other, can't remember where I got this picture from. So now I'm blanking on where this picture is from. But to the left, and this might, the picture on the right, let's just say it might look very familiar to many of us that live close to coastal environments in lower middle income countries. And this might be in Caribbean, it might be coastal Africa, it might be South Asia, where there's a high degree of vulnerability. To the left, you have a resilient system, which is highly resources, count with a high degree of resources like knowledge, technology, financial, legal frameworks, governance mechanisms, etc., that allows them to see and design what are called floating houses. So they're basically, their houses are going to float as the sea level rises. To the right, you have an image where that ability is likely not there, right? That ability to, what will happen when these people face a growing sea level rise? They will likely lose their livelihood, which puts them at risk, at health risk, and as well, they will likely be displaced, right? So when we talk about resilience and vulnerability, you can see these two things interacting with each other. So these are, again, as I said, yin and yang concepts. Similarly, this is another example. This is something that science is still kind of emerging from this, and I have 5 more minutes, and then I'll wrap up. This is another example on how climate change will impact differently different peoples around the world. This relates to nutrition. It just happens to be that this is kind of paradoxical, and this is the way I think about it. When we were in school, and some of you might know about, how we learned about plant biology in school, we thought about CO2 as basically plant food, right? It's what the plant takes from the environment and then uses it to create leaves and bark and roots. I thought about CO2 at least as plant food. And it just, some people actually thought, well, in a more CO2 rich environment, there's going to be more growth of plants, which is not necessarily untrue. Some people are saying, some of the science are saying that there will be what we call global greening, which means the template forest will probably move to the north and there'll be more green, more template forest. Now, if that's good or not, probably not, because it means that our glaciers are likely decreasing in size and we're going to have other consequences based on that. So we can't just look at that. But what happens with food is actually quite interesting. in rich CO2 environments, sometimes the plant will actually grow more. The plant, be it soy, be it rice, be it maize, be it wheat, it might grow more, but it won't be more efficient. And definitely it won't be as nutritionally packed as it should be. So as you can see here from this graph here, and many researchers have now confirmed this, the level of zinc, iron, protein, and other micronutrients, which are basic and staple for people's diets around the world, is gonna decrease. And that means that the person who is on the verge of having an anemia, on the verge of having a protein deficiency, on the verge of having zinc or iron deficiency, with the consequences that that comes, they will now fall under nutrition. And the people that were already undernourished will be further undernourished. And you can see here again how this impacts and relates to the concept of vulnerability and resilience. So this is let's say, something that has been coming up in the science in the last 15 years, and now it's been kind of ratified, but it is part of how we understand how different populations will be affected. And obviously, when we look at the total numbers of who bears the responsibility of things like emissions growth, right, we see this in this graph. You'll see the poorest 5% of the world here, the richest 5%. We'll see here, obviously, that the richest 5% is responsible for the growth of around 50% of emissions. So that is the richest of the rich, right? Not just countries, but people, because we all live in nations where there are people that are accumulating wealth in very obscene manners, right? Those people around the world are the ones that carry the weight of emissions growth. And in Spanish, or at least in Costa Rica, we have a saying, which is, usted se come la piña, y a mí me duele la panza. And I always say in Spanish first, and then translate it in English, which is, you eat the pineapple, but it is my tummy that hurts. When we look at the consequences of, let's say, climate change, and where we can see more climate-related mortality, of course, this is what we call a cartogram. This is a type of diagram in which the size of a country is determining here, in this case, the size of a country determines its global share of carbon emissions, right, or total share of emissions. So the bigger the country, the bigger the emissions. So let's say China, West and Central Europe, the United States, Japan. Obviously, they carry the weight of the most emissions as high emitting countries and high income countries. But when you look at the consequences, that is the mortality consequences of climate change related death, you see that the countries that carry the least weight on the emissions are the ones that are suffering the consequence. Usted se come la piña, a mí me duele la panza. And that is how we can look at all these elements, not just related to mortality, but also to other forms of morbidity, like infectious diseases, like non-communicable diseases, etc. But of course, this will not happen forever. This is my last set of slides, so I'm going to ask for a couple more minutes because I know my time's up. When we look at this graph, and I want you to pay attention first to the y-axis, which is basically relative health gains and relative health losses. That is, how much health is being affected due to the x-axis, which is degree of environmental change. That is, here we have no environmental change, and here we have a bunch of environmental change. Not just climate change, but a bunch of biodiversity loss, a bunch of pollution, a bunch of changes to our ocean, a bunch of changes in land use, right? And the more you go here, right, and this is where we are today, let's say, this is where we are today, we're in a degree where we're already in orange. We're not yet in the red. Paradoxically, this is what's happening around the world, and you might think about it in the context of your own individual life and nation and region, right? Paradoxically, when we map out different populations around the world, we actually notice that populations that have more power around the world, which is this one's on the top, are actually seeing an increase in their health despite the fact that we're facing environmental change. And populations that have less power, here graphed in the bottom, are already seeing health losses. And this is creating, obviously, health inequities, but it's also widening the power inequities. Now, in this paper, what do we mean by power? We mean power not in how usually it is meant which is financial power, which is one way that is read in the literature. So when we look at power, it is usually conceptualized in a very unidimensional way, whether it's things like age, power of the unborn, power of children, power of elders, power of adults, or by income, power of people living in poverty, people not living in poverty, high income, low income, people by status of development, developed, developing, high development, low development, industrializing, industrialized, people that are marginalized, people that are included by geographic or historical variables, things like the global north, the global south, the west, the rest, the first world, the third world. Some of these terms obviously are updated, are outdated. But when we look at the literature, usually the concept of power is one of these. And they try to say, oh, the people in the global south will suffer the consequences, or the people living in low income countries will suffer the consequences. Because we mostly come from low and middle income countries, we know that in our countries is where actually there is more inequity between the rich and the poor, the powerful and the powerless. So it's not a matter of nations, regions. This is happening at a global scale. Those differences are happening. And we need to think of power as this multidimensional concept that includes everything: income, gender, religion, nationality, socioeconomic status, sexual orientation, social capital, migratory status, age, education. Power comes into all of this. So the populations that have least power, right, again, coming to this one, are already suffering the consequences. You see this. And the people, paradoxically, that have the more power are actually living better lives despite global environmental change, which is paradoxical. But that won't happen forever. Of course, as we increase our environmental change and we maintain this status quo scenario, that well-being, those gains will be lost eventually, and everyone will suffer the consequences. This is one of the reasons we have delayed so much action on things like climate change, because the people that have the power don't suffer the consequences. And because they don't suffer the consequences and apply an equity lens to this program, then they don't act. Obviously, the people that are with more power are living their lives like nothing is happening. You know, the meme, everything is all right, and then there's a burning living room. That is exactly what is happening right now. So the consequences of this, some of these other implications, you might read this paper, Acting on Power and Health Inequities. We give out some examples and some recommendations on how to incorporate the power matrix into your analysis. But I'll finish there because I know I'm out of time. Oh, maybe one more minute. It's fine. There you go. Thank you. Thank you for that. I'll just finish here, just to kind of finish on a positive note. Some of you might already recognize where this is coming from. This is Kate Raworth's work. This is the donut. Some are calling it the lifeboat or lifeguard or, el flotador. But this is the concept of that I want you to kind of leave with, because this is driving a lot of policy around the world. Basically, it's saying that there are ceilings to our ecological capacity to keep us well. That is, there is an amount of climate change that we can create before we start seeing the consequences. There's an amount of ozone layer depletion. There's an amount of pollution. There's an amount of ocean acidification before we actually suffer the consequences. But there's also as a floor, if that is a ceiling, there's a floor that we need to take into consideration that secures basic rights like water, food, shelter for everyone around the world. So, and in the middle, right, there is a space called safe and just space. So what this summary of this image is, and this is, again, very important today because it's driving a lot of policy, it's saying there is resources out there that we need to use to keep us well. These resources are things like our biodiversity. These resources are things like where we get our energy from. These resources are things like our soil and our land. We need these to keep our well. But we shouldn't extract so much resources that then we start suffering the consequences from that, which is happening today. But we shouldn't use so little resources that we can secure safe and just space for everyone around the world. This image I want you to leave with. If you can, visit the website, and I'll stop there because now I'm 6 minutes over time. So thank you for that. I'll stop sharing because I know now Stephanie is going to go into a case study. All right, thanks for that. It's supposed to be cold here, but now I'm warm because I do a lot of this.
Very much, Carlos. Muchísimas gracias. That was an amazing and stimulating intellectual journey that you took us on, but not just intellectual, because you had a lot of concrete examples of how inequity and planetary health are coming together. In my introductory talk in this course, I spoke of patient Earth and the complex and dynamic balance that we are in to enjoy the health that we do. Thank you. And the last thing you said was among the last things was also important, that eventually this gets everybody, rich or poor, it's going to get you. So it's beginning to happen with the heat and the fires, and there's no more climate comfortable anywhere.
Exactly.
So we're going to turn over to Stephanie from Suriname. So we move from Central America to Northern South America. Stephanie, over to you.
Thank you. Let me just share my presentation. Can you see the presentation?
Yes.
Okay. Yeah, so I was going to start with a little introduction, most of which has already been said by Dr. Guzman. But my case study is based on a vulnerability assessment tool. So I want to give a little introduction about vulnerability assessments. And these are used to identify the risks and vulnerabilities of communities. And it helps us understand where a community is vulnerable, and knowing where the vulnerabilities of communities are will help us in building resilience in these communities and help prevent or reduce the impacts of the hazards of climate change. He gave a great explanation about equity and related to climate change and health. And equity is the basis for understanding the distribution of the impacts and the responses to climate change. And then the most important part for communities is the ability to bounce back from the impacts of climate change. And that's why the resilience aspect is so important. He already also explained that vulnerability is impacted by our exposures to different stressors. It could be climate impacts, extreme weather events, but then also the sensitivity or the degree to which a community or persons are affected by these events differs from area to area, but also within countries. And the ability for those communities that are impacted to adapt to these changes will determine the health outcomes that they experience. So he already also explained the links between the social determinants of health, ethnicity, culture, demographic factors that also influence the vulnerability and adaptation capacity of these different communities and the impacts they experience. I want to go over to a little bit of an introduction of Suriname. Suriname is a small country that's situated at the northeast coast of South America. We have French Guiana to the east, Guyana to the west, and Brazil to the south, and the Atlantic Ocean to the north. We are situated in South America, but due to economic and political reasons, we're also considered a Caribbean country. Suriname is the most forested country in the world. We have a 93% forest coverage, which I hope we can maintain. At the last census that was in 2012, we had a population of a little over 541,000 people, but the General Bureau of Statistics estimated that the mid-year population in 2021 was already above 616,000. And we have a pretty equal mix of male and female in Suriname. So to give a little introduction about the health part in Suriname also, Suriname is divided in 10 10 administrative districts, of which most are located on the northern coastline. And we have 4 districts that are a little bit more to the south, of which the biggest district is what you see in the map here, the big green part, that is Sipaliwini. Our healthcare is divided, the primary healthcare is divided between the coastal area and the interior. For the coastal area, we have the private clinics and the regional health services that offer services to the communities there. And our communities in the interior are mostly dependent on primary care provided by the medical mission. Suriname has a very small population. We have a large forest coverage, but more than 90% of our population lives on the coastline, which is not even 10% of our country surface area. And more than 70% lives in the capital, which is the smallest district, that is Paramaribo. Our hospitals are mostly located in Paramaribo. We have 7 hospitals in Suriname, of which 4 are located in the capital. 1 is in Wanica, which is the district bordering the capital. We have 1 in Nikeri, that's the district bordering with Guyana, and 1 in Maroena, which is the district bordering with French Guyana. So there is no hospital care outside of the coastal areas. All these hospitals are located in a coastal area. And I think for context, it's important to know that Suriname has tribal communities. We have indigenous people and we have the Maroon tribes, which as was already indicated, the different persons experience the impacts of climate change differently. And the most vulnerable people are those who are at lower social economic levels or have less care to have less access to medical care. And those are mostly the tribal communities in Suriname. The communities, we have communities in the interior that cannot be reached by road. So if you want to reach them, if there was something happening, which is already experienced, you need to either fly over or go by boat, which can take sometimes from hours to days just to reach one location. So we've had in Suriname been experiencing some of the impacts of climate change, mostly flooding, but we've also this year been experiencing heavy droughts. And these droughts have caused entire rivers to run dry. And the rivers we have in Suriname are a bit different than the rest of the Caribbean. We have very large rivers. So for a river to run dry and have that be the only transport to villages in the interior, I think you can imagine the impact that will have on those communities. If they need healthcare, if they need food, how would you get to those communities? The tribal communities are also very reliant on their environment. They hunt, they live off the river, they fish, they do agriculture. And it may seem as just agriculture to be self-sufficient, but there's also people in the interior that have larger agricultural crops that are sold to the companies in the capital that produce, for example, juices or other food products. So if something were to happen in the interior, it would also impact us in the capital and other coastal cities. We've had floods that washed entire communities away in the interior. In the capital and other coastal districts, we also had floods. May it be a little less severe, but you can, because the case study I'm going to be going into is more focused on the indigenous communities, I want to give some context to why it is important to look at those communities with a broader lens than just the general public. I want to also, if this wants to work, I have a little video about Suriname. It does not want to play, but I think if you get the presentation afterwards, you could also look into it. It's a very fun short video about the different cultures we have in Suriname. Oh, it's starting. And the diversity we have, not only related to the culture, but also yes, so that video gave a little intro into Suriname, our culture, our coastal area that's the capital with our historical buildings, and then the interior that's forested and a little more difficult to reach, and also our cultural diversity. In Suriname, like I said, we've had impacts of climate change already, and in every district, all 10 districts, we've already experienced the different impacts of climate change. From from droughts, floods, heavy winds. We've had this year, due to the droughts, we've also had a lot of forest fires with thick smoke, which also had its health impacts. We've had also a lot of Sahara dust that has been blowing over, as the rest of the Caribbean has also been experiencing. And for especially Nikeri and Saramaka, those are the two most western districts in Suriname. They are our biggest agricultural areas. The droughts and flooding have also impacted the crops, which also impacts our food production, but also our export capacity. Yes, so for my case study, I worked with a indigenous community in Suriname to develop a community water vulnerability assessment tool. And the goal was to develop a tool that could be used by that community for them to assess their own vulnerabilities, and that would give them basically the power to see where their vulnerabilities are, what can they do, where do they need to adapt, and also for us as policymakers at the Ministry of Health and the regional health services and the medical mission to also see where we need to come in related to the healthcare service provided. So it was not an easy process. Tribal communities, like the different countries, have a hierarchy in leadership. The tribal communities also have this. So every tribal village, be it indigenous or Maroons, has a tribal leader. And it's usually the captain And then you have a lower level tribal leadership and that's the Basha. And then they decide what happens in these villages. So you can't just enter a village and start doing a project or try to get an intervention done. You need everything you want to do in these villages, you need the support from the tribal leadership. And getting their support is not always as easy because of past experiences they've had. So they are not easy to trust people from the government. So it is a process that you need to really get that trust-based relationship built before you can really get into what you're trying to do to help that community. So um, we've had, from the Bureau of Public Health, we've had in the past tried to do interventions related to vector-borne diseases in this specific village also, which were not successful. But then again, like I explained, they are not very open to outsiders, but specifically outsiders from the government. So we needed to find a different approach to reaching this community. And for the past couple of years, the indigenous people have bundled with each other and created an association for the different village leaders. And they are represented there. And if you get the support from this association, they then can help you contact the village you're trying to reach and get a meeting with them so that you can explain what you're trying to do, listen to their needs, and then get the support for the project. So that's what we did. We first had the meeting with the association, then we had just a meeting with the association and the village leadership. Um, and it's important to also consider what they think, like it's been said in previous sessions of this course, that we should not underestimate the experience of the community and the knowledge that they have of things going on in their community and the impacts that they're already experiencing. So it's very important to take that with you in those meetings, take what they're saying, what they say they see, what they um, indicate that they need from you, and include that in the project. Um, After that, after we got the green light for the project within the village, we started with orientation visits to really see what the situation is in that community related to water resources and water use, but also possible threats associated to the water resources. Um, and the village leaders nominated 3 village champions who were allowed to work with us on the development of these tools. And I must say that these persons were more than eager not to only help with the development of the tool, but they became kind of our eyes and ears in the village, or champions that would not only just work on the tool, but also if they saw something within the village that needed attention, or um, they helped us also spread the message about the importance of climate on our health and why certain aspects are important for the village. What can they do? Um, they helped us with the information sharing, but also a little bit of health education, especially related to vector-borne diseases. And from the village, they had some concerns related to water quality. So they indicated they wanted some water sampling done as a basis for the tool, so they would have some satisfaction in what is being put in the tool and what's being told to them, because it's easy for us to say that certain activities are polluting the water, but if they think it comes from another source, you are not trustworthy at that point, and if you don't consider the sources they indicated. So we I must also indicate that this village is not one that is very far from the capital. This one is reachable by road. And even though they are right on top of the main water aquifer that is used for the drinking water production in Suriname, most of the village does not have access to running water. So there is a lot of people there who still use rainwater harvesting, but there's also people who dig wells into the aquifer for their water needs. They've also dug some holes, made kind of like ponds that they use for recreation. But because those ponds are not connected to the creeks in that area, it's basically still water, which means that there's no good oxidization of the water, which then also gave them issues. So on the bottom right, you see a nice looking like a lake almost. It's a very big pond that was dug by the community that was used for recreation. But due to the degradation of the water quality, they are right now not able to use that because they are already experiencing skin irritations and stuff like that. So for the tool, we try to really get the community to tell us what their sources were, what their uses were, and what they saw as the threats, and help them. We help them to put that on paper and then digitalized it, and we try to make it easier, especially seeing that not everybody in the area speaks Dutch, not everybody in the area can read and write. So we also use pictures that were taken in the area of the different situations that were included in the tool um, to make it easier for them to do the assessment. So from one picture to the other is basically yes, no, and then that leads you to the next picture to help you identify from the water sources to the uses to the risk and eventually also the health impacts. During the field visits and the development of the tool, talking with the different people in the village, we also realized that there was a need for um, training and empowerment of the community to make them a little bit more aware, but also self-sufficient in taking care of their water sources, their water supplies, because those are also posing a big health risk from water supplies not being covered to them not being used in the correct way, which also could result in contamination and then health effects. So we added a train the trainers community workshop. We invited the entire village through the village leadership. And as in most tribal community, is mostly the women that show up because the men are working outside and the women are responsible for the household and the crops and taking care of everything around the house. So we had a lot of women, we had some children join also, and later, as the day progressed, we saw also men joining the workshop. So we discussed what we saw in the field, we discussed what they had indicated as their concerns for contamination of their water sources related to activities from outside persons. Even though it's an indigenous village, you have economic activity around that village. So they were concerned that those activities were polluting their sources. So discussing the observations, was it economic activity that was polluting certain water wells? Was it, for example, latrines that weren't properly built, and then help them and give them the guidelines on how to correctly do that? If you have a well and a latrine, how do you need to take into account the location of those two and the proximity to each other, the water flow in the ground, so that you can be sure that you don't yourself contaminate the source you use for consumption. We also included environment and health. How can they take care of the environment, and how can that help them in their food production, keeping their food safe, their crops safe, but also their living environment safe from all kinds of environmental contaminants, but also um, foodborne diseases, vector-borne diseases, and waterborne diseases. Personal hygiene, how do I, because seeing as most people there don't have access to running water, it is more difficult for them to wash their hands regularly. And if they wash their hands, then they're not likely to use soap because they're trying to save water. So um, helping them with that aspect, giving them the tools on what to look for and what do I need to do, how can I um, ensure my personal hygiene without using too much water or contaminating the water source that I have. And also, how do I take care of my water sources? Um, because there is no running water, it's most often that people would use buckets, that they would use their hands to go into the bigger storage tanks to collect water to use inside of the house. Sometimes people would wash their hands in those big containers. So what we introduced there are the faucet buckets, as we like to call them. You have a picture on the uh, top right there. Um, During that workshop, the team instructed them on how to construct those buckets themselves. We gave them the materials, we gave them the tools on for making those buckets, and we gave them instructions on not only how to maintain these and keep these clean, but also how to use it. This would offer them a form of taking water out of the bigger water container outside, boiling it, disinfecting it, and then putting it in the smaller containers, so they would, on a day-to-day basis, so that they would at least have a little bit of running water inside that they could use for consumption, for cooking, and if necessary, to wash their hands, instead of just putting your hands in the bigger buckets. But also vector control, covering their water supplies, how to screen their houses. It's the simple things that we mostly take for granted in the capital, because yeah, we have windows, we have air conditioners, we have fans, we have bed nets, but for people in the different villages, that's not always easy to have access to, but also not easy to maintain. So working with their cultural traditions and what they see as appropriate for their culture, and then building on that. What we also did was work with them on the proper hand washing techniques. We use the glow germ gels and the black light to really give them a hands-on experience on why just washing your hands with a little bit of water doesn't clean them, even though that you don't see the dirt, the germs are still there. So that gel really had an impact on them, seeing that in real life. And we've asked them to also teach what they've learned during that workshop to other members of their community, of their family that were not present at the workshop. Um, Yes, so we've had some good feedback from the community. It also gave them a direct line to the Bureau of Public Health, the Environmental Inspection Department. They were the team, they have our telephone number, they know how to reach us. So we're hoping that in the future we have more contact with them, although it's not always very easy, seeing that there are different priorities at play. You have the government's priorities for certain interventions, but then you also have the priorities of the community itself. And you can't impose what you want on communities. So taking that into account, we really need to build on their needs. And then once they request the support, we're there to help them. From the government side, what now is in place is a water platform that is led by the Ministry of Natural Resources. And they are in the lead because they are responsible of supplying drinking water to the entire population of Suriname. So we are working with them within that platform, trying to get all relevant stakeholders from the government, but also some very important NGOs included in that platform to work with them on everything related to water, not just drinking water, but also sanitation and wastewater, and working with them to on different projects for the water supplies to the different communities. Because if it's not feasible to get a big water treatment supply for especially the villages in the interior, then there's the option of rainwater harvesting supplies, that in which you have, for example, the Ministry of Public Works that has their guidelines for different constructions, but also from the Ministry of Public Health, the vector control and the disinfection and sanitation part. We give them guidelines, and then we also train those communities that receive these treatment plans and those water treatment, rainwater harvesting facilities on how to maintain these and how to really get the ownership from within the community and not just wait on the government to do everything. So that was it for my presentation. Thank you. And if there's any questions, I'm here to answer them.
Thank you very much, Stephanie, for a very grounded presentation about the challenges in Suriname. One thing she did not tell you about Suriname is they've got fantastic food. So if you like food, that's a great place. Now, Carlos has to take off. So and there's lots of questions, more than we can probably get through, and then a couple of announcements to close us off. So one question perhaps you could both touch on is just say a little bit more, how does climate change impact the determinants of health? And how would a newborn be affected by climate change today? So maybe quickly, Carlos, because you have to go, and then Stephanie. Just say a bit more about how.
I mean, the newborn question is interesting because actually the effects of climate change obviously start from the womb and even before, right? And we're talking everything from the quality of the nutrition that the mother has before pregnancy and during pregnancy, and the consequences that it has over the baby, as well as the quality of the air that this person is exposed to before they are carrying their baby and during the moment, but as well in the peripartum moment as well, the exposure to high salinity in water is due to things like high levels of sea rise that might penetrate water sources that are drinkable, and that might elevate the sodium, and that might impact things like preeclampsia. All these consequences we're seeing around the world, and they're quite and they're quite intertwined, as I was explaining before. So this is not just about the newborn baby that, yes, will have more consequences if they're exposed to, let's say, higher temperatures and heat waves. Obviously, the newborn has least capacity to regulate or self-regulate the temperature and is much more vulnerable to things like undernutrition and heat strokes and whatever it might be. It really needs to be understood from even before pregnancy, the consequences that this might have over a newborn. And then there's kind of a flurry of consequences that might happen in the later stages of life that have been studied quite well, and the consequences of undernutrition in the first month of life, and the consequences that might have on things like non-communicable diseases later in life. Let's call it like undernutrition in the mother might also have consequences in the breast milk, and that then has consequences on the on the newborn. All these things are super interconnected. It's hard to point at just one, but the more science emerges, the more we know that this is something that starts before the baby is born.
Well, somebody's saying this course is the best virtual course they've ever had the privilege to attend. Well, that's quite a positive note for all the faculty, including you, Carlos. Stephanie, there's requests for your tool, so I think if you could share it, we would be happy to share it with others. As Carlos pointed out, the implications for newborns. Do you have anything quick on that, Stephanie, in the situation you're experiencing in Suriname?
Yes, so in Suriname, like you said, there are different aspects that could impact the child from starting from within the womb and then after birth also. And for Suriname, what also has an impact, especially in the interior, is deforestation for mining, for example, and the use of mercury in gold mining. And that starts also from pregnancy on. And especially in the hard to reach areas that don't have roads where you can easily access the healthcare services, it would be a lot more difficult for the mother to really get the child the healthcare that they need at the beginning stages of life, but also, uh, sorry, yeah, so also it would be more difficult for the mothers to really take care of their child in the best way possible if they don't have clean drinking water available at their household. So there's different aspects that impact the child.
So really bringing home the points that Carlos set out about climate affecting determinants and the eco-social mix, the complex and dynamic nature of health as an outcome of all of these things. Carlos, I call pollution and biodiversity loss the evil twins of climate change. Okay, so thank you very much to both our presenters. We just have a couple of closing announcements. Thank you for the participants who have stayed the course with us. Haley, have we got a couple of the closing slides? Thank you. So thank you to the course faculty who have accompanied us on this. We've had faculty from Suriname up to over to Costa Rica now and through much of the Caribbean and beyond. It's been an amazing 5 weeks. Thanks to the faculty. And special recognition to our planning team. Well, I can't thank myself, Dr. Paula Henry, who has been a tremendous force behind the marketing, Dr. Carrie-Anne Peart, Cecilia, who her husband says is a force of nature, a good one. Daniele at GCCHE, Haley Campbell, who is our indefatigable project manager for this, and Chris Aura at University of the West Indies, the Climate and Health Leaders Fellowship. Several of his fellows were faculty for this course, so we're really happy with that partnership. And to the interpreters, Lourdes, Ana, Soledad, y Adriana. Excellent. From Uruguay, it looks like, from your web handle. Now, just 2 closing announcements. You can join the Global Climate and Change GCCHE community as an academic institution. Haley, do you want to do this one?
Yeah, sure, I can take over. So hi everybody. So on behalf of the GCCHE team, I just want to congratulate you all on making it to the end of this course, and I hope you feel ever more prepared to incorporate climate and health principles into your work. So our team, we would like to invite you to join the Global Consortium on Climate and Health Education to enhance your commitment to advancing climate and planetary health education into your field of practice. So membership is entirely free, and there's 3 ways to join. You can join as an academic institution or university, or you can join as a partner organization. And lastly, just any individual is welcome to join our community, and there'll be a link in the chat. And congratulations to you all again, and we hope to see you at future Earth Medic, Earth Nurse, GCCHE programming. So yeah, congrats.
Thank you, Haley. And you can also join us in Earth Medic. You get on the website, earthmedic.com/pledge, and it's free to do this. There's no charge. Takes about 1 minute to take the pledge, to take action, to improve planetary health through advocacy, through training, research, and practical projects. I think I saw in the chat somebody asking for how you could form a local group. So we are open to forming local chapters, and you can send me a WhatsApp if you're interested in doing that. The last thing I'll say is the CME session link has been posted, and the survey link has been posted, and the exam will be open from 8 o'clock tonight. So thank you all again, everyone. With lots of positive comments coming through on the chat. Thank you very much. It feels good to be doing this. And the last thing is what's next? Well, you may remember after we first did this course, we had a workshop webinar series on climate and non-communicable diseases. So what I've been hearing most from people is how to, now that we have this information, how do we do this? How do we do that? So we're going to launch this in autumn of this year, more action-oriented sessions. And in the survey feedback, we'll be asking your input on a range of how-to questions. You know, how do you write a press release? How do you if you only have 1 minute, how do you talk to your patient about climate? How do you engage an elected official? How do you measure carbon footprints? There's a bunch of how-to questions we're going to ask you to give us your input, so to help us plan a high-quality series based on your climate and health interests. So thank you very much again. I think that's the last one, is it? Merci beaucoup. Efaristo Poli. Muchas gracias. Obrigado. Thank you very much, and good night to everyone.